Agriculture is an essential industry that provides food and resources to the global population. However, it also presents a wide range of respiratory hazards to workers due to the nature of the tasks and the environment in which those tasks are performed.
Dust is the most common hazard. Dust and particulate matter are generated by plowing, tilling, and harvesting. Inhalation of these airborne particles can lead to respiratory irritation, bronchitis, and exacerbation of pre-existing respiratory conditions.
Mold and fungi can grow on crops, stored grains, and in agricultural buildings, especially in damp conditions. Inhalation of mold spores and fungal particles can trigger allergic reactions, respiratory irritation, asthma, and respiratory infections. Where there are animals, there is also dust, dander, and allergens. Working with livestock or handling animal feed can expose agricultural workers to allergens from animal dander, urine, feces, and saliva. Prolonged exposure to animal-related allergens can cause respiratory symptoms such as nasal congestion, coughing, and wheezing, and may lead to conditions like occupational asthma.
Agricultural workers often come into contact with various pesticides, herbicides, fungicides, and fertilizers. Inhalation of pesticide vapors or dust can cause respiratory irritation, chemical pneumonitis, and exacerbate chronic lung conditions. Riding in an enclosed tractor cab helps, but not all cabin air filters provide protection from hazardous chemicals. Grain dust, which is generated during harvesting, processing, and handling of grains, can contain allergens, mold spores, and bacteria. Inhalation of grain dust can cause respiratory irritation, coughing, and wheezing, and can also lead to a potentially life-threatening condition called grain dust-induced bronchitis or pneumoconiosis. The handling of hay and straw, common in animal bedding and feed, can also release fine dust particles into the air.
Hazardous atmospheres are most common in manure pits and grain silos, but can exist anywhere in a confined space. These hazards require special consideration and are covered in the Confined Space Program.
Certain agricultural tasks, such as tilling, digging, and working with sand or soil, can release silica dust into the air. Prolonged inhalation of silica dust can result in silicosis, a serious and irreversible lung disease.
Another lesser hazard: farm equipment and machinery powered by diesel engines. Diesel engines produce exhaust fumes that contain particulate matter and toxic gases. Long-term exposure to diesel exhaust can contribute to respiratory problems and increase the risk of lung cancer.
While not a traditional respiratory hazard, heat stress in agriculture can lead to increased breathing rates and the inhalation of more contaminants present in the air. It can exacerbate existing respiratory conditions and pose risks to workers' overall respiratory health.
To mitigate these respiratory hazards, agricultural workers should use proper personal protective equipment, PPE, such as masks, respirators, gloves, and goggles. Adequate ventilation in confined spaces, proper hygiene practices, and regular health checkups are also important measures to safeguard respiratory health in agricultural settings.